Good morning, guys. I have discussion aid for you this morning. We are discussing when end of life care meets electronic medical records. Okay, so that is A for you. Let's get going. Short answer: when end of life meets the electronic medical record describes the practical and ethical intersection where advanced care planning do not resuscitate orders and other end of life EOL directives are recorded, stored, and shared inside electronic health record EHR systems, and how that affects care, delivery, access, and patient experience. What the phrase means: the phrase frames a collision of two domains, the clinical human and the clinical human centered and work of planning and delivering care at the end of life, and give me 1 second, the technical data driven world of electronic medical records. Signals attention to how EOL wishes advanced directives POLST forms, palliative care notes are captured digitally, whether those records are available in real time to clinicians, and how that availability or lack of it changes outcomes and decisions at clinical moments. Why this matters in practice: timely access to EOL documents can prevent unwanted interventions and reduce distress by ensuring clinicians see a patient's preferences during emergencies or care transitions. Programs that integrate POLST and other EOL documents into health information exchanges or EHR workflows aim to make these orders discoverable across settings: hospitals, EMS, long-term care, so care aligns with patient goals, patient and family experience. Research also shows that well-implemented electronic EOL records can reduce anxiety and improve bereavement outcomes when they work as intended. Compassion in dying. common benefits and promises. Improved availability. EHRs and registries can make advanced care plans accessible 24/7 to authorized clinicians, reducing reliance on paper forms or family recall. POLS or POLST consistency of care. When orders are visible across settings, teams are more likely to honor patient preferences. Data for quality improvement. Electronic records enable measurement of how often preferences are documented and followed. These potential gains depend on technical integration and clinician workflows. The promise is real but conditional. Compassion in dying. Typical barriers and risks. Interoperability gaps. EHRs and regional registries don't always talk to each other, so documents may remain visible when they're most needed. Usability and workflow. Usability and workflow friction. Clinicians may not find or trust EOL entries. They're buried, inconsistent, or not present clearly in the chart. BMJ supportive and palliative care. Implementation variability. Systems differ in how they store legal orders, various narrative wishes, creating confusion about what is authoritative. Compassion in dying. Broader EHR challenges. General EHR implementation issues. Data quality, clinician burden, and training also affect EOL documentation success. World Journal of Advanced Research and Reviews. Bottom line, the title points to a systems problem with human consequences. Digitalizing end-of-life preferences can greatly improve care alignment, but only if technicians design interoperability, clinician workflows, and patient-centered processes are addressed together. Okay, guys, that's your A for today. I will be back on with B shortly. So I'll be back on as soon as I put that together for you all. For now, Gator Wellness, take care, folks.